everyone, I'm Isabel. I'm the Secretariat of the Global RA Network, and today I'm with Cheryl Koehn, the President of Arthritis Consumer Experts. We will be talking about the newest tool that the network and its members launched in June 2022 to further advance RA policy change in the member countries, and which is called the Rheumatoid Arthritis Dashboard. Can you tell us about ACE and your role at ACE?
You bet. Hi, Isabel. It's really a pleasure to be with you today. So Arthritis Consumer Experts was founded 23 years ago. We are the largest and longest running arthritis patient organization in the country. We are a national organization doing our education information provision in both official languages, French and English, here in Canada. We have about 50,000 members coast to coast. Many of them have rheumatoid arthritis. And we really work together as a team. I'm part of a senior leadership team that makes certain that everything ACE does is reflective of the needs of the membership. So my specific role, Isabel, is to make sure that we stay true to our vision and our mission, which is to gather the views of people living with arthritis across the country, to take those views and articulate them through our advocacy programming, which is what we do at an international level with the Global RA Network, and also to deliver education information programs that are really by, for, and with people with arthritis. So that's who we're all about. And we helped found the Global RA Network back in 2016, as you know, and have been so pleased to be a member and working side by side with our international colleagues to advance the awareness of and implementation of models of care in rheumatoid arthritis.
So can you tell us now what's the RA dashboard? Yes.
The RA dashboard was conceived by the leadership group that makes up the steering committee of the Global RA Network. And we decided that one of the best ways of capturing attention of audiences, and primarily we're talking about government here, as well as healthcare providers in our community, was to be able to assess or count what currently exists in terms of models of care. So we know that models of care don't really exist sort of start to finish for a person like myself living with rheumatoid arthritis, not even in what we would call an advantaged country like Canada or the United States, or perhaps some of the Scandinavian countries. There are gaps or holes in each of them. And to fix them, you can't fix a problem unless you can count the problem. And in so many of our member countries, Isabel, we found out through our membership, through our leadership of the patient organizations from all of the countries that participate in the network, that they couldn't even get access to who has RA in their country. What kinds of services are available to those people living with RA. They couldn't even get, government won't even give them the numbers of how many people have arthritis, period, in the country. So we went on a fact-finding mission to find this out in each of the member countries, and then to be able to display it in a very visual way. And it's actually quite eye-opening when you look at the RA dashboard and you see the data in plain sight, in plain view, and you can see what we call the have and the have not countries very clearly just by looking at the RA dashboard.
So what are the key findings in Canada that you can find in the RA dashboard?
Well, in Canada, what we learned was that people with RA in our country, no matter where they live, we're getting a different model of care. And I want to be careful when I say that, because it suggests maybe to some of the viewers that there is a model of care. Well, in some provinces, the model of care is simply reimbursement for some of the drugs and access to some rheumatologists. But to have the whole model of care package, Isabel, we learn that there are significant gaps. And I think one of the key gaps is that we learned that just over 60%, so well over half of the population with RA here in Canada, RA patients, are waiting longer than a month to see a rheumatologist or a specialist who is capable of diagnosing RA after they started experiencing their symptoms. Why is this an important finding? Because we know that permanent damage to joints, tissue, lungs, heart, eyes, can be done in the first 6 weeks and can't be undone. You can't undamage a joint once the joint is damaged. We don't have any science that helps rebuild cartilage, that is the protective lining at the ends of the bone that form a joint. We don't have any magic serums that would stop the inflammation, which is what drives a lot of that damage. So we are not seeing people in that, what we call window of opportunity within the 6 weeks. There's a problem. And what our findings suggest is that people are waiting, over half are waiting more than a month. So be exceeding that 6-month period, or pardon me, 6-week period to get an actual diagnosis and to start treatment. Of those, 33% wait more than 3 months for their first rheumatology visit. So imagine you have an inkling that you've got RA, and then you're waiting again to see the very specialist that is going to be able to help, we hope, fingers crossed, arrest the disease or stop it in its tracks. The chances of stopping the RA, what they call inflammation cascade, are greatest in those earliest weeks. So if you're waiting beyond that, Isabel, your chances of having disease remission are reduced. There's just no question about it. That's what the science and the data from our dashboard tells us. And then, of course, we know that in Canada, we are, I don't want to say privileged, but we are certainly an industrialized country with a more modern healthcare system that is aware at the governmental level of at least the existence of models of care, that they should be implemented across healthcare systems. So in comparison, Canada versus, other countries, Brazil, Slovenia, Serbia, Croatia, we are, I don't want to call us lucky, but we're further ahead.
What are your plans with the dashboard? What will you do with it?
Yeah, so, it's not one of those cases where if you build it, they will come. We have to take the dashboard to the audiences that we want to talk to. So already several of our members have used the dashboard, our European members, where there are significant gaps, where there are gaps in the data on the dashboard, have already used it as an advocacy tool to kickstart conversations with their government. We are going to do the same here. As you know, Isabel, you're also situated in Canada. We've been doing, we meaning Arthritis Consumer Experts, has been doing this systemic advocacy work around models of care for a number of years. Making change at the policy level, which is at government, is a slow process. But we have seen progress. One of the essential elements, for example, in a model of care for rheumatoid arthritis is to be able to have more time in your rheumatology office. And who can make that happen is an arthritis health professional, not necessarily a rheumatologist, right? So this is a cost-saving measure in a model of care that frees up rheumatologists who are in very short supply here in Canada. And if we employ another health professional who has all of the right skills to counsel me about medication taking, to help me get started on an exercise plan, who will help deal with some of the psychosocial, psycho-emotional issues or challenges that people with rheumatoid arthritis face. So that's a key piece of a model of care for RA that is not consistent across our provinces and territories. So that's one of our big aims with using the RA dashboard here in Canada, is to advocate across the country that we need a billing code, for lack of a better way of putting it, installed in the healthcare system, so that a rheumatology office can bring this type of healthcare professional in to expand what they can do for us. And it's actually cost savings or cost neutral. So it's in government's best interest to do this. This they wouldn't know without the RA dashboard, without us taking it to them. It's also a great tool, and we plan to use it to build relationships with the rheumatology and research community, Isabel. Even though we have a lot of the data, our data could be better. You know, we could have additional data on the dashboard that, let's say, is broken down by province. So we're hoping that by partnering with the rheumatology community, we can gather more of the data that we need to make these very compelling arguments at government that they need to be doing more in the creation of and implementation of a holistic model of care for people living with rheumatoid arthritis in the country. So those are just a couple of things that we're, and of course, I would be remiss in not saying, first and foremost, this is an incredible information tool for people like me. People with arthritis in Canada don't understand the burden. They know, they hear their neighbor talk about their own disease or joint complaints, but people with rheumatoid arthritis specifically, it's hard to see one another. We're not a common disease, nor are we uncommon. So this is like providing a picture for people like me of what it's like for others across the country who are living a day-to-day life as they are. So I think it's both informing our patient population, but hopefully lifting them up through knowledge as well.
So here we are on the homepage of the Global RA Network website. To access the RA dashboards, just go into the menu on the top right-hand corner of the screen and go to RA dashboard. You're on the landing page where you can see all the countries having a dashboard available in their own local language or languages. If we go to Canada, as you can see, the dashboard is available in English and in French. Let's do English for the purpose of this video. And you can see the Canadian dashboard. So the top of the screen is dedicated to general health information, where you can see data around the population, total population in Canada, life expectancy for men and women, annual health expenditure here in dollars, Canadian dollars, and then 2 elevated risk factors, which are obesity and the number or the percentage of smokers in Canada. Then when you scroll down, you can see 2 graphs. One about arthritis in Canada and one about rheumatoid arthritis in Canada. Some dashboards do only have arthritis in their countries because RA data is not always available. So on that graph, you can see the prevalence, so the total number of people living with arthritis, and on that side with RA. And then we detail how many women, how many men, as well as the frequency, so the incidence. As you can see here, it's 1 per 1,000 people per year. Projections, the estimated number of people living with RA in 2040, which is 585,000 in the case of Canada. And then we also indicate the cost to society for RA, and that compiles healthcare costs and loss to the economy. And as you can see here, it is 6 billion Canadian dollars. So you can compare with the arthritis data on the left. When you scroll down again, you have on the left-hand side a section dedicated to the models of care for RA. The first line indicates if there is or not a standardized model of care in the country. In the case of Canada, we've indicated that there is none. And we then go to share the number of rheumatologists per 75,000 people, and that's 0.62, so not even 1 per 75,000 people. Then we indicate the time to diagnosis for RA after experiencing the first symptoms, and that's explained as the percentage of patients getting a diagnosis, an RA diagnosis, within 1 month. As you can see, there are only 37% of people being diagnosed with RA within a month. Underneath, you have the wait time that RA patients do experience for their first rheumatologist visit. And this is in percentage of patients waiting longer than 3 months to see a rheumatologist. This is 33% of Canadians who wait longer than 3 months to see a rheumatologist. In the right-hand side, you can see listed here the barriers to virtual care. In the case of Canada, 4 have been identified, which are lack of digital skills, the access to internet, that's unequal in the country, the cost of electronics, so of the devices, and the language. And then at the bottom of the page, you see data sources. You can click on the plus sign to have those data expanded, and you can see all the references here to the different literature pieces that we researched to populate that dashboard. And as you can see, all these data sources are publicly available literature. At the very bottom of the page, you see that band showing that you can click here to download a printable PDF version of the dashboard that you can bring to your meetings and show to the stakeholders who you're trying to show the gaps in the models of care around RA and arthritis. And you can also go back to the full country list of dashboard to check other RA dashboards in order to compare between countries, the status of RA care in those countries. And that's available for, as you can see, different countries in the Americas and in Europe. And there will be more added as we can find available data for different member countries of the global RA network. Well, thank you, Cheryl.
It's my pleasure. Thank you, Isabel, for the invitation. It's always lovely to see you and talk with you.